So this was the question about SAM, that is severe acute malnutrition. So how do we define severe acute malnutrition? Weight for height less than -3 standard deviation. There will be severe wasting, which will be visible. Presence of bipedal edema, and mid upper arm circumference will be less than 11.5 centimeter. So this is how we define SAM. SAM mostly it is seen between 6 to 59 months. So in this question they have given the hospital management, and we have to choose the exception, which is not the hospital management. So how do we manage SAM? So this is a table from PTR. If there is poor appetite, edema, and any medical complication with any one of the following, then we will go for hospital management. So if there is hypoglycemia, hypothermia, infection, electrolyte abnormality like hypokalemia, dehydration or diarrhea, in any of this condition we will go for hospital management. If there is no poor appetite, no edema, no medical complication, then we will go for home management. So what we do in home management, we start nutrition 175 kilocalories per kg per day. We give amox for 5 days, vitamin A, albendazole and vaccines. What we do in hospital management of this patient, there are two phases. One is stabilization phase and one is rehabilitation phase. So stabilization is day 0 to day 7. On day 1 we start with 70 to 80 kilocalories per kg per day, 0.8 to 1 gram of protein. Then on day 7 we increase it up to 100 kilocalories, 2 to 3 gram of protein, and we start with F75 diet, that is 2 to 3 hourly. And on day 7 we give all the micronutrients like vitamin A, K, copper, zinc, folate, except iron. We don't give iron in the first week. We don't give iron in the first week because there is a risk of free radical injury, so we avoid giving iron in the first week. Then coming to the rehabilitation phase, which is from 2nd to 6 weeks, we start with 175 to 200 kilocalories per kg per day. We increase the protein intake from 4 to 6 gram. We start with F100 diet, and we add iron from the 2nd week, that is in the rehabilitation phase. So what are the primary failures we can see in this management phase? If there is failure to regain appetite by day 4, there is failure to lose edema by day 4, there is presence of edema on day 10, or failure to gain at least 5 milligram per kg per day by day 10. So these are all the indications of primary failure of the treatment. And dehydration in SAM is measured by urine output. So coming to our options, treat hypoglycemia, hypothermia, infection, yes. Feeding and micronutrients, yes. Start catch-up growth after stabilization, yes. Start iron from day 1, no, this is not the answer. We start iron in the rehabilitation phase. We avoid giving in the first week because it has increased chances of free radical injury. So B is the answer.